Let's start with this one.
Yeah.
Yes.
It's a very simple, very thorough slides, right? Anyways, first, what is the skeletal system? Basic definition of the skeletal system.
To
A
like
system of
Oh,
bones that supports the system. Oh, not just bones. Bones,
yeah.
cartilages, tendons, ligaments Tendons, that make up ligaments. them. Okay.
And this number is important because then it'll make it easier to remember the regional classifications of bones. Um, Remember this, then when we're finishing the first regional classification, then we can rewind from here.
Okay, let me ask
What
one quick
is
question. Let me ask one quick question.
okay?
Out of those 206 bones, how many are axial and how many appendicular?
80 are axial and 126 are appendicular,
Sorry, 126 and?
and they are 80 are axial and
Okay,
126 are appendicular. There are
got
further subdivisions to that as well, and in
it.
under a chart, it's a lot easier to remember that subdivision.
ठीक है, okay.
Okay. So we have this, which is the simple diagram of the bone. When we do the structural classification of a bone, that will make this a lot easier to remember. Not structural. Sorry. According to shape, because this is a long bone. So a long bone's basic classification is the diaphysis shaft, which is longer. A long bone is longer than it is wide, and then we have the two articular joints, which is the epiphysis and the two epiphysis right here. And then we'll have an overview of this later on as well. So this is just for now. These are the four classifications of bones: visual classification, according to shape, structural classification, and the developmental classification. This slide does not cover developmental classification. I haven't covered it as well, so I'll probably do it from BD Terrace myself. We can do an oral version to that. Anyways, regional classification includes two: the skull, thoracic cage, and the vertebral column is the axial classification. This is because they are, just think of it as the single most connected part. They are continuous. There's no discontinuation in the axial system, while the appendicular system, which has the limbs, mostly all of the limbs are the axial system, the appendicular system. Sorry, and if you see, wait, this is a better image there. If you see this, you'll notice that this part, the axial system, is all connected, while the limbs, the the pelvic girdle, all of this is disconnected from it. The subdivision of the exoskeleton of the 80 bones, the easiest way to remember it is through the diagram. This one. Remembering the numbers isn't that hard. It looks intimidating only, but it is easy once you have these down. The skull and associated with bones, also okay, we'll go step by step, right? Exoskeleton divided into three subtopics: skull and associated, thoracic cage, vertebral column. We'll do the head first. Skull and associated has 29 total bones. Then that is also subdivided into two, which is the skull and the associated bones. Under the skull, 22 bones, associated bones, 7. Under the skull, there are 22, so there's the two subdivisions of the skull, the cranium and the face. Cranium has 8, face has 14. Associated bones. Oh, wait, are you following? Should I be asking that? Are you following?
Yeah, yeah, yeah. Go ahead, go ahead. Yes.
Okay. Okay, so auditory ossicles, easiest way to remember is the ear. Each ear has 3 bones. So you multiply by that 2 and 6. So auditory ossicles, and the hyoid bone, which also the hyoid bone is a sesamoid bone like the patella. And this is present in our this area under the first what's it called? The first few divisions of the vertebral column. It's right under there, and it acts as the pivot. It's one of the
Mm.
things involved in the pivot of our neck. That
Yeah, and
is for the
yeah,
29.
it is the only
Hmm?
bone in the body that is not connected with any other bone. It's an independent bone, not
Hmm.
connected to anything else. It's connected through
I
ligaments.
didn't know that one. I didn't know
Yeah,
that part.
Same.
and this is the
Okay.
bone. This is the bone that gets broken when somebody
During what's it called?
choked.
Hanging,
Hanging.
right?
Yeah,
Capital
Mhm.
hanging.
punishment.
Yeah.
Hanging, choking,
Yeah.
that part. I remember.
Hmm.
So we're
That's the
supposed to learn
29
all these
bones.
first, like all the.
I
Yeah,
feel like
I saw one question
this is
that,
a good thing.
that asked how many uh, total number of bones in axial skeleton. So if that
Okay.
question came in, then
Also, learning this part, like they don't have the appendicular skeleton system. I'll share my drawing of it, but that's not nice either. But they don't have the appendicular skeletal system in this. Like in learning these numbers for the whole thing, it's not even that hard because you just multiply most of them. Also, it also helps understanding the rest of the slides or the descriptions of the bones, because then you're like, oh, this is present in this area, so and we know what this
Right.
area's function is, so that makes it easier to remember further on as well. The
Okay.
regional classification is the easiest part to remember so far for me. After the okay, so let's do simple. What is the what is the division of the skull and skull and associated bones? Number of bones present in skull and associated.
I'm sorry, ask that question again.
42.
Number of bones present in the skull and associated bones.
So skull were
24.
So
eight, and eight bones, and then the facial bones were
skull
facial.
and associated bones. Not just this, just not just limiting it to the skull, the associated bones as well.
24.
No, it was total of
No,
No.
it
29.
was
Total of 29.
29.
22.
Yeah, total non
Yeah,
29.
29. This is the
29.
correct answer.
Yeah.
Good job. It was the total one was 29. What are the subdivisions? The first two subdivisions.
I'm sorry, repeat that again.
What are the first two subdivisions of the skull and associated bones?
Cranial and facial.
Yeah, yeah. And then for the associated bones,
Um,
The hyoid bone.
yeah. Okay.
and
Auditory
and
ossicles.
yes, how many is the cranial bones?
Uh,
12.
29. Oh, excuse me, eight. Eight cranial
No,
bones.
just yes, eight. How many are the facial bones?
If there are 22 in the skull, then that would 14. Yeah, maths.
Yes. And how many bones are present in the associated bones total?
29 minus 22, 7.
Okay, and what are the subdivisions of those seven bones and numbers of those seven bones?
There's only one bone which can break during hanging, so one hyoid bone, and the rest would be the auditory something. Six
Yeah.
auditory.
Ossicles.
Auditory ossicles, yes. Then we have the thoracic cage, 25. Okay,
Mm-hmm.
simplest
Yeah.
thing, all the ribs, 24, and then this one center,
The neck.
sternum,
The necktie. The
and then
necktie.
this next second. Oh yeah, necktie. Oh wow, I did not
Yeah.
think of that. Oh my
Yeah.
god.
Yeah. It looks like a necktie.
Oh my god. Yeah, it does look like a necktie. And then after that, we have the vertebral column, 26 in number, subdivided into vertebrae, 24, sacrum, right here, and then the coccyx at the end, the tail.
Coccyx. Coccyx.
Yes, coccyx.
Sacrum and
But
coccyx.
yes, shall we do a test?
Okay.
Okay.
How many thoracic bones are in the body?
25.
25.
What are the subdivisions of the thoracic bones?
Sternum and
21,
ribs.
24.
I did not ask for the number. I said subdivisions only,
Okay.
Sternum and ribs.
Yeah.
right? Um, what are these numbers of subdivisions for the vertebral column?
24 plus 2.
They would technically not count as plus two because they're both
Isn't it 25
specifically
bones?
different bones. In the vertebral column, no. Thoracic, the only 25 we have is the thoracic cage itself, having 25 total, um, which is then subdivided into the sternum and ribs. So that makes it 25. 24 ribs and one sternum is equal to 25. The
Mhm.
vertebrate column itself is divided into how many subdivisions?
3. Sacrum, coccyx, and vertebrae.
Yes. How many
Mm.
vertebrae in the body?
24.
Yes. How many coccyx and sacrum?
One each.
One each.
Yes. How many total bones in the body?
206.
206.
406.
Um, Name the four classifications of the skeleton system. Skeletal system.
Mm, Regional, structural, uh,
Functional
what else? Oh
According to
yeah,
shape.
Yes.
and
Yes.
shape.
development.
Yes. Define a skeletal system.
Um, System of bones, tendons,
What?
Cartilages,
cartilages, um,
ligaments.
and
One more.
ligaments.
And ligaments, yes.
Yeah.
What else is there in this one? I mean, what are the subdivisions of the regional classification?
Repeat the question.
What are the subdivisions of the regional classification?
Oh, axial and appendicular.
Perpendicular.
How many bones present in
80,
each?
80 axial and 126 appendicular.
Um, how many subdivisions to the axial system?
Four,
Um, 3.
three. Oh, okay.
Name
My bad.
name them.
Skull,
Vertebral,
thoracic,
thoracic.
yeah, and vertebra.
Yeah. Okay, then there's this. The thing is, this one doesn't have a diagram like this, but I can tell the numbers. Anyways, this is the appendicular system. Skeletal system consists of um, 126 bones. It has four major subdivisions: the pectoral girdle, which is the clavicle; collarbone is the clavicle; and scapula is the shoulder bone. That makes the pectoral girdle. Then there's the upper extremities, the forelimbs, makes the humerus, radius, ulna. So for numbers, pectoral girdle total is four. There's two scapulars in the body, and then two clavicles. For humerus, again, two humerus, two radius, two ulna. Then the hands, we have 16 carpals in the body. So the wrist bones, 16 carpals in the body, 10 metacarpals, and 28 phalanges. So
Mhm.
phalanges are the extreme ends. Metacarpals. So if you look at your wrist, right, your palm area is the metacarpals, your wrist area is the carpals, and your finger areas are the phalanges, right? So there's 16 of the wrist bones, there's 10 of the palm, and 28 phalanges. So finger extremities. Understanding? Is everyone following me?
Yeah, we are.
Yes, Miss Aeman, yes.
Ah, yes, thank you.
Yep.
You teach better
How
than
many
physical effects. Sorry.
how many bones
Exactly.
in the pectoral girdle? How many bones in the pectoral girdle?
Uh,
4.
four.
Six.
Two
Four.
Four.
collarbones
Name
and
Four.
two
the
shoulders.
Yeah, collarbones
Two
name
and
the
shoulder.
scapula, two clavicle.
no, name the medical names, not
Scapula
the
Um,
and
shoulder.
clavicle.
Yes, which one's the clavicle?
The
Collarbone.
one on the
shoulder
top,
bone.
collarbone.
The
Nah,
collarbone
collarbone is the
Collarbone.
clavicle. Don't
and the
trust me,
scapula is
man.
the shoulder
Why
bone.
would I guide you? Yeah, scapula is the shoulder bone. The
Yeah.
also another thing, because scapulas are mentioned for later on as well. The structure of a scapula is that it's wrapping around. So it's wrapping around the back, and it ends over here ish, somewhere around here, right? And then the clavicle connects towards the scapula. So that the structure of the scapula is also important because it helps in the according to shape classification. Then next, how many of these how many bones are present in the upper extremities?
Six.
No, you have these as well.
Oh, okay. 16 carpals, metacarpals, and 10
No, carpals.
phalanges.
Eight
You're right.
phalanges.
No. 16 carpals, 10 metacarpals, and 28 phalanges. I'll tell you something right now. The only thing that should be difficult, should be a bit confusing, is the carpals and tarsals numbers, because metacarpals and metatarsals both are 10, phalanges both are 28. So these are 28, these are 28, these two, and then these are 10 metatarsals, and then these are 10 metacarpals. However, for this, we have 16 carpals and 14 tarsals.
Hmm.
Following?
Yeah.
Yeah.
Okay, we'll do this, and then when we finish, we can revise easy. We
Sure.
have okay, so we have two femurs in the lower. Oh wait, sorry. Before that, my bad. We have the pelvic girdle. So from top to bottom, we have the pectoral girdle, the upper extremities, the pelvic girdle, and then the lower extremities. Under the pectoral girdle, we've already established there are four bones. We've already established the number of bones in the upper extremities. The pelvic girdle only has the pelvic bone, and like the scapula, it wraps around, as you can see. But there are two pelvic bones. So this is divided. So this is one bone, and this is one bone. That makes up the pelvic girdle only. And then we have finally the lower extremities. So one femur, two femur, the patella, two patellas. The tibia is the another thing. The tibia is the shaft, the longer bone. The thicker bone is the tibia, and the thinner bone is the fibula. If I can get a better picture, actually, this is better, right? So this thin one is the fibula, and this one is the what's this? What's the thicker bone's name?
Tibia.
The fibula.
Yes. No, fibula is
Yeah, the small
the
one.
thin bone. Another thing is that the fibula name, the etymology of fibula suggests that it is to support. So you can understand it like that as well. It's supporting the tibia. You follow?
Yeah. Awesome.
Okay. Let's see. Okay, so there's two femurs in the body, two patellas in the body, two tibias, two fibulas. We'll go with this again. How many tarsals in the body?
14.
How many metatarsals?
10. No. Yeah, 10.
Yes, yes.
Yeah,
And how many phalanges?
20.
28.
28.
Oh, so
Yes.
damn.
28 or 20?
28.
Okay.
Phalanges are 28 for both the upper extremities and lower extremities. Metatarsals and metacarpals both are 10. Um, 10 each, not 10 in total. 10 each.
Okay.
5 per foot. And
Hmm.
then we have the okay, so you can also establish it like this. So we have carpals which are 16, right?
Hmm.
And if we establish the number of subdivisions, we have one, the humerus, two, the radius ulna, three carpals, three, um, sorry, sorry, I'll explain again. Subdivisions of the upper extremities: number one is the humerus, number two is the radius, number three is the ulna, number four is the carpals, number five is the metacarpals, and number six are the phalanges, right? Same
Hmm.
for the lower extremities: one femur, two patella, three tibia, four fibula, five carpals, tarsals, six metatarsals, and seven phalanges. In the arm, we have 16 carpals around here, but in the feet we have 14 tarsals around here. However, in the feet we also have two patella. So if you do it like that, you can even out the number of bones present around the feet in the lower extremities in that way. Do you follow? That
Hmm.
way, the subdivision for
Yeah.
the number of bones for both
Can
are
you
even.
please repeat that? The patella part?
Okay. Okay, so you understand how there are 16 carpals here, right?
Hmm.
Yes.
But there are 14 tarsals here. So it makes
Yeah.
you wonder how the lower extremities and the upper extremities are even. That is by the patella, which is 2.
Oh,
Do you
so it
follow?
makes 16.
Okay.
Good opportunity. Okay. Everyone describe what a skeletal system is.
Two and six
Define a
bones
skeletal system.
System of
lined
206
with
bones and
Tendons,
cartilages, skeletons.
cartilage, ligaments.
ligaments.
What do they come together to make?
The skeletal system.
Skeleton.
Hmm.
How many bones?
206.
206.
How many classifications?
4.
4.
4.
What are the classifications names?
Regional classic,
Regional,
Regional according to shape.
structural, based on shape,
ape,
and
and functional.
You said functional.
I said functional.
Okay, you said functional. There's one missing. You've named
Hmm.
three.
I think we did four. So, regional,
Structural, regional
structural,
according to shape.
shapes,
ossification. Where does that come in?
Sorry,
Ossification. Um,
that is just the
so that's
development of
going
the
to be
bone.
development. Yeah, development
God
classification.
damn it, I gave the answer. That was cheating. That was cheating.
Okay,
Anyways,
okay, okay, okay.
You caught
no
Okay.
me.
marks given.
Not the functional.
No,
Okay.
because
Development.
that doesn't have to do with
Okay, got
function.
it.
It's development, right?
Hmm.
Okay. What are the two subdivisions of the regional classification?
Axial skeleton and
Appendicular.
appendicular skeleton. Yeah.
How many bones in each?
80 and
80 in
80
axial,
axial,
126.
126
126 in
appendicular.
appendicular.
Okay, wait. I'll start asking specifically, right? That's easier.
Yeah.
Um, how many subdivisions in the appendicular system, Isra?
Don't ask me. Ask someone else.
Okay.
I
how many
Four.
how many subdivisions? Yeah. Okay, four. What are the
Four.
names of the subdivisions, Khadija?
Pectoral.
Girdle.
Yes.
I don't. The upper limb, lower limb.
Yes.
I don't remember the
It's
first
better
one.
if you go in
Angle.
order, by the way. For anatomy, when you're doing anatomy, anything in anatomy, you should go by order from top to bottom or bottom to top so that the examiner does not hit you.
Uh,
Yeah.
I feel like
So yeah,
it's part of
pectoral
it.
girdle, upper extremities, then the hip
pelvic
bone. What is it
girdle.
called? The what girdle,
Pelvic
pelvic girdle,
girdle. Yeah.
and
Pelvic
the
girdle. Okay.
lower
Yes.
extremities.
And yes. What are the subdivisions to the exoskeleton?
Axial, cranial, and
Thoracic.
thoracic, and vertebral.
Yeah.
And how many bones are present in the skull and associated bones?
Skull would be 8 plus. Uh,
14.
oh,
And then
No, I
29
one
think
total.
hyoid
29.
and
Yeah,
yes,
29 total.
29 is the answer.
yeah.
Yes.
Okay.
How many bones are present in the? Just name the bones present in the lower extremities.
Um,
Femur,
excuse. Yeah,
patella,
tibia,
fibula, tibia,
tibia,
fibula,
tibia and
and
fibula.
then tarsals, metatarsals, and phalanges.
Oh wait, this is cheating. Wait. I just realized that. Oh, not fair, not fair, not fair. No, wait, why does every? Okay, this is better. Anyways, um, what are the bones present in the? Name the bones present in the thoracic cage and their numbers.
Sternum, one sternum,
One
and
sternum,
20
24
ribs.
24,
ribs.
24.
24
24.
ribs.
Okay, name the bones present in the vertebral column.
Um,
Uh,
24 vertebrae.
Okay, wait.
One.
Noceba. Name the bones present in the vertebral column.
जी बोलेंगे जी बोलें
and the
Name
question
the
repeat.
bones present. Name the
नहीं
bones
मैं
present in the vertebral
असल में ना
column.
मैं अपनी मामी के आई हुई हूँ और वो कढ़ाई लगी हुई है तो वो खा रही थी साथ साथ
Oh.
Wow. अकेले.
अच्छा तुम्हें आना है मामी के तो आ जाओ अच्छा बताओ ना क्या सवाल था
Name the bones present in the vertebral column.
Name the bones present in the vertebral column.
Types of bones. Types of vertebral column bones.
Types of
Yeah,
vertebral.
just the subdivisions.
अच्छा
अच्छा चलो अब इतना नहीं मूव ऑन.
इधर
मुझे याद है 7 सर्विकल अल्लाह की फजल से 12 थोरैसिक 5 लंबर 5
मेरी प्यारी दोस्त
जी
मुझे भी नहीं पता जो तुम अभी कह रही हो just say vertebra the sacrum and the coccyx that's enough
अच्छा the
man.
sacrum and the coccyx I thought you were asking the spinal nerve things okay fine सही है
No
yeah
bro I haven't even done that yet.
अच्छा okay sorry continue
uh, um,
भाई आप
Ahmed number the
attention,
bones.
you pay attention or go out of the class. We would not mind it.
oh no actually मैं अपने आप को ये मैं
I'm
आपको ये
copying.
ख्याल
Shahnaaz,
दिया
you have
था
to
कि
go
शायद
for a
अभी मैं इस
second.
मीटिंग में बैठी
I'm
रहूं
just copying someone. I don't want you to leave. I'm just.
He's
oh
not
okay
serious
okay
Nusaiba.
okay
It's
okay
okay. I'm the teacher
I'm
here. He
cracking
doesn't
a
have a
joke. You know,
say.
all the teachers they start yelling. आप attention करें कि आप क्लास से बाहर चले जाएं. अब वहां जाके खाना खा लें मुझे कोई फर्क नहीं पड़ता इससे.
आज पता है क्या हुआ आज मैं फ्रंट रो पे बैठ के सो गई और मेरे खटाटों की आवाजें आ रही थी एंड आई डिडंट नो
Oh
अंटिल
boy. Oh no! Did somebody take a video?
yeah I think
Oh
Anam
my
took a
god. Oh my god. Oh my
yeah it was
god.
really bad it was really bad Aeman
oh,
I didn't
yeah,
know
I
how to
I should
remember.
ask Adam to send the
We're
video.
sitting with Miss Anam, right? Yeah.
yeah
Sofa
and I
pe.
was snoring that's so embarrassing
चलो तुम्हारी बर्थडे वीडियो लगाते हैं वो.
अच्छा ठीक
Anyways, Ahmed number the vertebral columns, the bones subdivisions of the vertebral column.
Um, we just did that, right? So there's the coccyx, there's the sacrum, and then the 24 vertebrae. So 26 in total.
Yes. Yes. Okay. Name the no, not name. Sorry. Name number the two subdivisions of the skull.
Cranial and facial.
Number.
Number 8 cranial and
And 14.
yeah, 14 facial.
Okay. Number the associated bones.
Uh, so 16 plus 8, that's 22, 7. 7 associated bones.
Name the subdivisions and their numbers.
Cranial 8, facial 14.
No, associated.
Oh, associated 1 and 6. 1 would be the hyoid bone,
Hyoid,
and 6 would be
Yes.
the auditory or something.
the
Yeah.
Auditory ossicles, I think.
Yes.
Auditory os.
ossicles. Yeah.
Yes. Okay. Um, Khadija, name the number the hand bones.
Okay, so humerus, one humerus, one ulna, and one
No,
radius.
that's arm. Hand.
Oh, okay, okay,
Hand.
right. Okay. So 10, 16 carpals, 10 metacarpals,
Yes.
and 28
Yes.
phalanges.
Yes. Yusra, name the upper limb bones.
Dude, I'm not that good at anatomy. I need to review it again.
That's what we're
Come on,
doing
just
right
pay
now.
attention. Pay attention. She
I am
went
paying
over.
attention, I promise. Yeah, it's the upper limb is the I need a hint. Because I'm
Somebody
getting
dropped again.
confused.
Okay, so
Is it the radius and the ulna? And
radius,
then
ulna,
the ulna,
and
uh,
What's the
the
one thing
scapula
that dislocates the most? Yeah.
the scapula and the clavicle.
Yes,
yeah.
ma'am.
What? Why? What? No, clavicle and scapula are not under the upper limb bones.
Yeah,
So
so
it's the radius,
This
the ulna.
they would be their own.
radius, ulna, and
That's
humerus. The
pectoral
radius
girdle.
under the
Ulna,
yeah, that's the
okay, the
pectoral
humerus.
girdle. Okay, wait. I'll tell you right. Under the upper limb bones, you have the arm and the hands. So the humerus, radius ulna, carpals, metacarpals, and phalanges. Just look at your arm, right? So
Phalanges.
you start with the humerus. You
Yeah, the biggest one,
um,
and then there's the
go
radius, and then
down.
the ulna, the carpals, the
Yes,
metacarpals, and the phalanges.
yes. That's the upper limb bones.
Okay.
Okay, who wants to name the lower limb bones?
Me.
Go for it.
So you start. Okay, so we don't include the pelvic girdle, right? So we start from the femur, then the two
Yes,
kneecaps, the patella, then the
yes,
tibia, the fibula, the tarsals, the metatarsals, and finally the phalanges. So, yeah,
yes. Um,
and they're both equal, the upper limb and the lower limb in number of
Numbers.
bones,
Okay,
60.
wait, can I review? Okay, sorry. There's 16 metacarpals, 10 carpals. I mean 16 carpals, 10 metacarpals, and 28 phalanges. 2 patellas, 14 carpals, 10 metatarsals, 10 metatarsals, and 28 phalanges on the bottom as well, right?
Yes,
yes.
yes, ma'am.
Okay.
Ding ding.
Good
Win a
job.
Done, done.
prize.
How there are two shin bones. Out of that, which would you describe as the fibula, and how would you describe the tibia?
So tibia would be the
Tibia is
main,
the
be the
Oh,
supporting.
anterior bone would be the tibia, right?
Ahmed got so serious. He used words, big words. Yeah, you're right. Um, the which one is the medial bone out of the two?
Medial would be the fibula.
No,
Oh,
when you
medial.
look
Tibia,
at
Sorry.
tibia.
Yeah, medial would be the tibia. Um,
yes, yes,
and
yes.
where would
Yes,
fibia would be on the side, so that would be lateral.
the lateral. Yes.
Mm.
Okay. What's left? I think we've done it. Oh, we have the appendicular. No, no, we did the appendicular system just now. Oh wow, we're done with this part.
Yay.
Any other questions?
You are a good teacher, Aman.
वही
You're
बोल रही
welcome.
थी
Yes, Salam
मैं भी
Mubarak.
बोल रही थी या अल्लाह मुबारक
Mm. Mashallah.
वही बोल रही थी मैं कि लाइक एमन
This is the
हमारे
only
टीचर
part
से
I
बेहतर
know.
होती है हमारी टीचर से बेहतर पढ़ाती है
Exactly.
You know, the funny thing is, I don't remember being taught this. I don't even think I attended this
Anna?
class. Yeah, it's a whole process. Okay, new subtopic starting. What is the next classification after the regional classification?
according to shape
Shape.
classification according to shape
There are six subdivisions of according to shape: long, short. Wait, what? This isn't short. Anyways, ignoring that. That's not very short of it. Long, short, flat, irregular, sesamoid, and pneumatic. Pneumatic is a very limited
Major area.
subdivision
Yeah.
because it only involves the upper-ish area of the
Maxilla.
mouth
And,
of the
Is
skull.
pneumatic the same
Yeah.
as
and the
sinusoidal?
pisiform.
Sorry.
Is
Is
pneumatic the
pneumatic the
same as
same as?
sinusoidal? I think
Yeah.
we
Yeah.
studied it.
From pneumonia.
Yes, it is. It moves.
Yeah.
Yeah.
Okay.
So it has relation to the breathing stuff, right? So pneumatic is the shortest subtopic. It's right here. The most distinctive thing about it is that you will find a lot of air spaces in this. Air spaces? Yeah, air spaces. Yeah, large
Thank
air
goodness for
spaces
that.
lined by epithelium.
Yeah, thank goodness
Anyways,
for
let's
that.
start
You
with.
know,
can you repeat that I joined from
Oh,
my phone
sorry. Oh, sorry.
that
The
airspace
distinctive part about the pneumatic bones, as their name suggests, they are involved in the breathing process, and their
okay
distinction is these air spaces that you will find in them. So we
okay
have the
thank you
sphenoid, the ethmoid, and the maxilla as main examples. We don't need to learn the facial bone names, but yes, these are the facial bones, by the way. So you can also make that connection that these would lie in the axial
next
skeletal
left
system.
phenol, ethanol.
Okay, let's start with the first. What is the first subdivision of the classification according to shape?
Long bone.
long
Yay!
long
So,
bone
distinctive definition: long bones are longer than they are wide, consisting
Wow.
of a long shaft, and the long shaft has fancy name diaphysis. What does the diaphysis etymology say? It is from growing through. So we know that this part is long. And then we have the two articular joint surfaces called the epiphysis. So this part is the epiphysis, and this part is the epiphysis, and everything in between is the diaphysis. As far as I've seen, that metaphysis is not really referred to in most scenarios, but also I have no idea what a metaphysis does.
won't they
So
Oh,
also ask about
oh,
the
me.
epiphyseal
Metaphysis
Very
plate
important.
forms. Yeah,
Yeah,
they
it is
do.
very
most
important.
important part.
Yeah,
Yeah,
so
it
I think there was
is.
a question. I saw the question as well. Which part of the bone plays a role in growth? And
the
that would be
metaphysis
metaphysis.
Yeah, that's the metaphor.
also where isn't in a long bone isn't there another thing called the epiphyseal plate
Yeah,
Yeah,
epiphyseal.
that's I believe the the top part.
Not the top
It
part.
wait, there is a
Isn't
diagram.
it in?
I
Isn't
think
it
it
like
lies
at
in the
the end of the diaphysis?
Eh,
Right there,
yeah. Oh,
epiphysis.
yeah. Sorry, it's here. Sorry. This is yeah. So this is like the metaphysis area, right? Right between the
yeah.
epiphysis and the
Yeah, okay,
diaphysis.
correction.
Yeah.
Correction. When I said plays a part in growth, I was talking about epiphyseal plate. So scratch that. I was confused with the epiphyseal. So epiphyseal
The
part
main.
plate, yeah, uh,
Yeah.
that plays a role in growth. It ossifies when people reach, after puberty.
But
And
wait.
because girls reach
Yeah.
puberty before, that's why they remain shorter, usually, normally speaking. uh, and boys keep growing, so that's why they're usually taller. So that's one of the distinctive features.
Real tears. Anyways, I have no idea. We I haven't done that part yet. We'll learn that together.
Hmm.
Okay, so what are the six subdivisions of the according to shape classification?
Short bone.
Long, short,
Irregular, sesamoid.
irregular,
Flat.
sesamoid, pneumatic,
Pneumatic.
and flat.
Yay! We did that. Wait, what? There's six. One, two, three, four.
Yeah.
Yeah, yeah. Good job. Good job. Okay, define a long bone.
Well, it's literally right
Wow.
on my
Very well.
face. They're longer than they're wide.
They're longer than they are wide.
Okay, now it's even
Okay,
more
can
closer.
the
Does
main part, the main part,
They consist of a long shaft, which is known as the
the
diaphysis,
medical part.
and
Yes.
they have two articular joint surfaces called the epiphysis. And there's some totally irrelevant part, according to Miss Aeman, which is the metaphysis.
Irrelevant because I have not covered that topic.
Mm.
Anyways, again, a long bone, it is not being referred to its size, just its shape. So another, the set of long bones in our body, the major set, are the bones of the limbs. So the long tubular bones are the humerus, the radius ulna, the femur, the fibula, and tibia.
And
And
that
then we have the short
metacarpals.
tubular bones. Wait, yeah, yeah, the metacarpal and metatarsals are the short tubular bones. And the phalanges are also short tubular bones. They are miniature long bones, as it says.
Mm.
So here's the diagram. Long tubular bones, humerus, radius ulna, femur, tibia, fibula. Always try to learn the anatomy in a size, in a structural manner, in a linear manner. So from humerus to radius ulna to femur to tibia fibula, or tibia fibula, femur, radius ulna, humerus. And then we have the short tubular bones, the metacarpal, the metatarsal bones, and the phalanges. These are both under what type of regional classification?
Appendicular. Oh, short ones. Yeah, appendicular.
Yeah,
Um,
yeah, yeah. All are appendicular.
and
All are appendicular.
mm,
None would be anything except appendicular. Wait, what? Oh yeah, it is. Oh my god, I got confused about clavicle being in appendicular. Anyways, um, yeah, the short bones. Somebody tell me what is the definition of a long bone?
longer than wide.
Longer than they are wide.
Yep.
Longer than wide
And they have a long shaft called the
of
diaphysis,
the
two
diaphysis.
articular joint surfaces called the epiphysis. And there are two types of them. There are long tubular bones, which are the tibia, fibula, And an example of the short tubular bones would be the metacarpal and metatarsals of the wrist and ankle.
Yes.
Anything I'm missing?
Wait, wait. What did you say? The last part. Repeat.
So there's long tubular bones and there are short tubular bones,
Yes.
right?
And you gave the
So
examples of.
so the example of the short tubular bones would be the metacarpal and metatarsals of the wrist and ankle.
Yes. Yes. Um. How many carpals? Sorry. How many metacarpals and metatarsals are present in the body?
10 each.
Yes.
Yeah,
Okay.
yeah.
Next is short bones. Short bones are roughly cube-shaped, have only a thin layer of compact bone surrounding a spongy interior. This is also another very important aspect because you could be asked to identify this in a histology slide. What is this? What is this type of bone? So you have the spongy bone interior surrounding the spongy exterior. So that is like just the simplest aspect you can memorize from it. Roughly cube shaped and
Mm.
thin layer of compact bone surrounding a spongy interior. Then the examples are the carpals and tarsals. Cuboid, cuneiform, trapezoid, or scaphoid shapes, which fits the carpals and tarsals. This is a wrong label, by the way. I don't know why it's like that.
Which label?
Yeah, the metacarpals are these. This is a bit. The one calling these the metacarpals is incorrect. This is the correct label.
Hasn't loaded in for me yet. Just a
Do you
minute.
understand? Is everyone following?
I
Mr.
can't
Sweat,
see
it's your
the
time to shine with the joke.
stuff wali labeling. Yeah, yeah, now it's good.
Oh, sorry. That was my Wi Fi.
Yeah, it's done a really bad job with the
About what?
arrows.
What?
The
Yeah, it has.
you
No, this one's fine. The one. Wait. You're all seeing the
the
same
above
thing, right?
one.
This one was very bad. This one's right.
The metacarpals.
Oh, look. Oh, look.
Yeah.
Oh,
Yes.
calcaneus.
Lovely. One second. Okay, so. Oops. The second part. So wait, somebody describe what a short bone is. If I know what a short bone is.
So they're roughly cube shaped.
Roughly cube.
And if I'm not wrong, there's a spongy interior which is surrounded. Sorry, there's a surrounding of a spongy interior, and there's a thin layer
No,
of
no, no. You were doing
compact
it
bone.
correct the first time. No, no, it was
So
correct the
the
first time.
oh my bad. So
Because
a
if the
surround
spongy interior
spawn.
was on the outside, it's more likely to break. Would you not think? Would it not
My
make it
bad.
more weak? I'm just saying. I'm not
True.
scolding. I can't scold. But anyways, yes. What is the definition of a long bone? What is the description of a long bone?
Disruption. Oh, okay. Uh, Longer than they're wide. They consist of a long shaft called the
Long
diaphysis
shaft axis.
and articular surfaces called the epiphysis. And they can be long tubular, short tubular. Long tubular would include the fibia or the tibula, And the short tubular would contain the
Wait,
metacarpal
you
and
already answered this
metatarsals.
question. Somebody else answered. You already answered it.
Uh, my bad. Too late now.
Ah, it's okay. I'll ask again later, anyways. What are the examples of
Name
the
the
short
person
bones?
next time, like
Yes,
Naveed
what are
Bhai
the examples
does.
of short bone, Naveed Bhai? Naveed
I'm
Bhai.
sorry, did you say something?
Yes. What
Someone's
are the
Did
not
you say
examples
paying
of
something?
short bones?
attention.
Oh, short
Yes.
bones. Yeah, the all the tarsals and carpals.
Okay, good
You want
job.
me to name them?
No, I don't need. I don't know the names either.
Okay, calcaneus in the foot and pisiform on the in the hand.
Oh yeah. No,
And
pisiform is like
actually,
Pisiform the
I thought.
sesamoid bone.
Wait. Yeah.
no, there's only one
It's
Yeah,
sesamoid
it's
bone in the body. Oh,
it
bhai,
is the
there's only one
pisiform.
sesamoid bone.
no.
Yeah, pisiform is the wrist.
What?
Pisiform is not?
Yeah,
No,
It's a
Miranda.
that's not a sesamoid bone.
It is.
I would challenge this. I would
It's
challenge this. There is only one
it's
sesamoid bone in the body.
okay. Name
Should
the
have
sesamoid
challenged
bone.
it when the teacher was teaching it,
Patella.
Naveed Bhai.
Name your sesamoid bone, Naveed bhai.
Patella,
What is the okay? Then
huh?
what is the hyoid bone? What is the hyoid bone?
That's a good question.
Under what
I
under
would call
what
it
description?
irregular bone. I would call it irregular bone.
But uh, but a hyoid bone has a specific structure to it. It looks similar. It looks similar
Chalo,
to a
I'll
patella.
look in. I could be wrong. I could be wrong, but that's how I remembered it from last semester. But
It doesn't
anyway,
look similar.
I want to
Oh my
show you
god, never
something.
mind. Hyoid bone does not look similar to a patella. That was my bad. But no, there are three sesamoid bones in the body that we have learned. It is one is the hyoid bone, two is the pisiform, and three is the patella. The reason for it is that the description of a sesamoid bone is that it's embedded in tendons or
Hmm.
joint capsules. The patella lies on the tendons of the femur, and the hyoid bone you've already mentioned. It is not connected to a single bone. So, what would it
Acha.
be?
So I
Sesamoid.
looked it up. I looked it up. So I was mistaken. I thought there's only one type of sesamoid bone, but there are two types of sesamoid bone. One, of course, is the two patellas and two pisiforms. So that's it. The hyoid is not a sesamoid
No.
bone.
Okay, wait 1 second then. Why do I have this in
Hyoid
my head?
then would be
I'm,
irregular then, right?
I'm looking
Hyoid
at
would
it.
be irregular.
I'm looking at it
One
from.
second, let me just check the book. That means I have mistaken my concept. 1 second.
Oh man, here's
Hmm.
another thing. Can I share my screen for a moment, please?
Yeah, sure. 1 second, stop
Okay.
using.
So I looked it up here. This one says four sesamoid bones, right? However, here's another interesting. This is from National Institute of Health from US, and that says there are many sesamoid bones in a person with up to 42 reportedly found in an individual. Actually, that could be one person who may have these bones. These bones are often formed in response to added strain to muscles and tendons, but can also be normal variants, most commonly present in hand. So that's just you know, that's not common. That's not for everyone. So common people, everyday people would have four sesamoid bones, the two pisiforms and two patellas. And I wanted to show you one other quick thing. Uh, Let me share the entire screen. Okay.
You know, the
And
same website, the National Institutes of Health, it is
yeah.
also classifying hyoid bone as a sesamoid bone. The hyoid bone is a small horseshoe-shaped bone located between the mandible and the shoulder girdle. It is classified as a sesamoid bone, which means it is a freely floating bone.
Mm.
Hey,
Acha,
let me
so,
ask a
so
friend.
I guess there is a debate on these shapes as well. Then, so that Easy Med, that said only four of these National Institute of Health is saying, you know, thyroid as well. Anyway, are you looking at this?
Yep.
Yep, your
Yes.
X-ray.
So this is my X-ray. You
Wait,
see
it's
this one?
his?
Yeah, this is
Yeah.
mine from March
Oh,
14th. You see this little part? This is a bone spur. This is what Ammon was talking about.
oh,
That this starts to create
Plantar
problems.
fasciitis.
Say that again?
Plantar fasciitis. That's the
Yeah,
name of the disease.
right. So this may cause problem, that it may become difficult to walk. But so far, there's no problem.
Yeah.
So, so what Eamon said was a technical name. Non-technical name would be a bone spur. So that was one thing. The other thing, okay. So this is the knee, of course. There's the patella,
Ella.
right? And then here is the shoulder, see the clavicle, and the
scapula.
scapula. And of course, you see this shoulder, this
Ball and
epiphysis
socket joint.
is very loosely connected. This is not this is not a very good socket joint, ball and socket. So that's why this is the most easily dislocated bone. And what was the last one? Oh, yeah, this one was a little more sharper image. See this part. So that should not be
The
there.
other one also, the other foot is also seemingly starting this
Yeah.
formation.
Yeah. So this is calcaneus. What bone is this? The
T
one on
something.
top. Talus. Talus.
Talus.
Valid. Okay.
Okay, calcaneus and talus. So I don't remember the remaining ones, but these two are easy to remember. Okay, that's it. I'm done. And I will hand it back to you. Okay, what's the plan? It's almost midnight.
Good question.
Let's
Maybe we
go
can
through
start
these
in five
quickly and
minutes.
then
Say that again.
let's go through the slides quickly and then go to questions maybe.
Oh, you want to
Okay.
do the questions? Okay. I was thinking we could also pick it up at 12 p.m. midday and then keep going
Yeah, we could do
for a
that.
few hours,
That's better actually.
Yeah, yeah, that's fine with me.
right? So
I'll
maybe
also have
take
time
five
to
more
prepare
minutes.
the
Yeah.
rest.
So, Eamon, take 5 more minutes to wind it down, and then we pick it up at 12 o'clock, and then we can break for a little bit dhuhr,
Tell
and
you what,
then
we can finish this subtopic. I'll just go very fast since we've done like two of the subtopics already, two more of
ठीक
them already, and only two more are left. I'll give
ठीक
like
है
a brief overview and then we'll stop. Okay.
ठीक है
And generally curved is the main point for flat bones. Flat bones are thin, generally curved with two parallel layers of compact bone sandwiching a layer of spongy bone.
Oh, like a
You can
Novita
see how
wafer.
every
Mhm.
oh wow, that's actually a smarter way. Yes, like that. It's just like a wafer. You have two thick layer. Yet you have a sturdy layer. In between is a spongy, however you want to define the spongy layer,
Yeah.
and it's being sandwiched by the two stronger layers, basically. And the point is that they are generally curved. This includes most of the bones of the skull, so all of these, there's everything in the skull here, and then the sternum as well, which is here. So the sternum and the skull. So this is, and the ribs are also flat bones. As you can see, they are curved, they are thin, and they have two parallel layers. And
Amazing.
the scapula is also a flat bone because you can see that it is flat. That's one explanation for the scapula. So we have the breastbone and the shoulder bone, includes the skull. Repeat. And then we have the irregular bones. Yeah, we have irregular bones. They do not fit any of the above categories. They are completely different in shape. Just look at them. How would you describe that? Irregular bones. They consist of thin layers of compact bone. Again, a thin layer of a compact bone surrounding a spongy interior. As implied by their names, their shapes are. Oh, sorry. Also, sorry. For flat bones, this is another important thing, right? So they resemble shallow plates and form certain body cavities. As you can imagine, the skull forms a body cavity and the rib cage forms a body cavity. So they are shallow plates and form certain boundaries of certain body cavities. Then you have irregular bones, do not fit into any above categories. Thin layer of compact bone surrounding a spongy interior, and obviously vertebral column is an example, and the mandible and hips are examples. Why the mandible? How would you describe this? Sorry, not this. This. How would you describe
because they have
this?
air pockets.
Sorry.
What was the question?
How would you describe this bone? Can you fit it into any other category?
Um,
I think
Irregular.
it's pneumatic.
Yeah, pneumatic
No,
because of
pneumatic
the air
is limited.
pocket.
No.
Oh, the
I'm
top
talking about
part.
this, the
Yeah.
jaw. No, the lower part. Pneumatic is only the top part
Hmm.
because so just it's anything that's touching the nasal cavity, right? This area touches the nasal cavity. That is why it is a pneumatic. This is the maxilla, not the mandible. The mandible is the lower jaw. The upper jaw is the maxilla. So this is the pneumatic bone. This is an irregular bone, and it is classified along with the vertebral column and the pelvic bone, so the hips, correct? But mandible is just like an extra bit. You can just remember pelvic and
Vertebral.
intervertebral. Sorry, vertebral column. So that's the easiest.
Mhm.
Finally, we did the sesamoid bones. Main definition: embedded in tendons or joint capsules. Sesamoid bones are embedded in tendons or joint capsules. They have no periosteum and they ossify after birth. I will tell you what this means, but I do not know. But they have no periosteum and they ossify after birth. So they don't exist in the what's it called, the fetus. It
The
doesn't exist in the
periosteum is
fetus.
just connective tissue. Periosteum is just
Yeah,
connective tissue that surrounds the bone. Yeah, it's connective tissue. So since they don't have it, then they don't have like it surrounds the bone, but they don't have
oh, so
any connective
it's
tissue surrounding the
surrounding
bone.
it instead of the periosteum. Okay. I got it. Thank you. So they ossify after birth, so they aren't present in fetuses, and they develop eventually after the newborn, uh, after the baby is born. Examples are the patella and pisiform. These are the two confirmed examples that we can take. Even if this part is wrong, we can just say it was in the slides and that it provides enough evidence. This is a teacher slide. Anyways, these are there are four functions, major functions of the sesamoid bones, right? Number one, they resist pressure, they minimize friction, and these two are the best way to remember that when you scrape a knee, this is around the knee, right? So when you scrape a knee, these are reducing the amount of damage that is occurring to your knee, which is why knees are also one of the strongest parts in your body, I believe. They alter the direction of pull of the muscle, and they maintain local circulation. Four functions of the sesamoid bone. Finally, pneumatic bones. They are certain irregular bones, and their main feature is that they contain large air spaces lined by the epithelium. Pneumatic bones are certain irregular bones that contain large air spaces lined by the epithelium, and their main function, you could say, is that they make the skull light in weight, help in resonance of the voice, and act as air conditioning chambers for the inspired air. So light in weight, obviously, when you're making something spongy, you're reducing its weight. Sorry, when you're making large air spaces into something, you're reducing its weight. They help in the resonance of the voice. You can imagine, since when you have when you close the nasal cavity, you can you can hear a change in your voice and act as air conditioning chambers for the inspired air, which is their main um, form of memorization. You can say them acting as air conditioning chambers. So examples: maxilla, sphenoid, and ethmoid. The maxilla, I
Sphenoid.
believe, is this sphenoid.
Sphenoid.
Sphenoid. Yeah,
Well, that's amazing.
that's lovely, and that is the
Awesome.
end
Good
for
job.
this. Which we did not
Great.
cover a lot for the time we spent. This one.
But whatever we did cover, we remember now.
Okay.
That's a new thing for me.
What are the four subdivisions of the skeletal system?
Well, there's regional classification, there's structural classification, there's classification based on development, and
Shape.
Shape.
yeah, shape.
Yes. Um, Number. Uh, Somebody just like go through all the numbers and divisions of under the regional classification.
Total 206 bones, 26 bones in the
No.
um, come on, the
Why
skull area.
26? Wait, what?
25 skull, no, 29
Okay,
skull bones. 20, huh?
wait.
29 skull
No,
bones. Okay.
you're not going by order. Wait. Okay, wait. Go by order so that way it's like no confusion, right? So axial classification divided into two: 80 axial, 126 appendicular. Skeletal system divided into three. Okay, wait, we can just remove this, right? So axial skeletal system divided into three. There's the skull and associated. There's the thoracic cage, and there's the vertebral column. Skull and associated has 29 bones, which is so the subdivision of the skull and associated itself. So skull has 22, and associated is 7. Skull has the cranium, which is 8, and the facial, which is 14. The associated has auditory ossicles, which is 6, and the hyoid bone, which is 1. Then we have the thoracic cage. So thoracic cage has how many?
26.
26.
26,
24 vertebrae
25.
and one coccyx, one sacrum.
And one coccyx.
Oh, thoracic cage
I
is
said thoracic
25.
cage.
25. Oh, one
Thoracic
sternum and
cage is
24
25.
ribs.
My bad.
Yeah, so one sternum and 24 ribs.
24
And we have the
ribs.
vertebral column. Vertebral column
26
is
bones.
26, and that
One
is
coccyx.
24 vertebrae,
Rib.
one sacrum,
What?
one coccyx. Appendicular
Yay.
is divided into four. Appendicular is four. Number one is the pectoral girdle. How many bones in the pectoral girdle?
Two. One scapula, one
2.
clavicle.
No. You
4.
have
So
Go
two
four.
for
clavicles
Two
and two
scapula.
scapula.
Yes.
Okay.
Yes. And
Wait,
then
repeat
we
that?
have the upper extremities. Okay, so in the pectoral girdle, there are two subdivisions, the scapula and the clavicle. Both are two in number because obviously
Yeah,
if
yeah,
there's
there's
one at
two
this side, you
sides.
needed it sometimes. So yeah, there are two scapula and there's two clavicles.
Okay, thank you.
There's the upper extremities, so the arms and hands. Arms has the humerus, radius, and ulna, and the hands has the carp. So
Carpals,
um,
the
Carpals,
16
metacarpals, and the
metacarpals,
carpals,
and
phalanges.
yeah,
phalanges.
Phalanges.
16 carpals, 10 metacarpals, 28 phalanges, 2 humerus, 2 radius, 2 ulna. How many in the pelvic girdle?
Only the hip bone. So
Two hip
two.
bones.
Or
How
two of
many?
them.
2.
Yeah,
Yeah,
two hip
2.
bones. Yeah.
Yeah, 2. We have the lower extremities. What are
The
their names?
patella,
One
uh,
one femur,
Go by
one
order. Go by order. Do
okay.
not
So
randomly start.
femur,
Femur, patella,
Yes.
tibia, fibula.
fibula.
Yes,
fibula,
and
Tibula, fibula, fibula,
tarsals,
and then the
metatarsals.
tarsals, metatarsals, and phalanges.
number all of them.
Number?
Yeah, number all of them. How many of them each?
Okay, so with two femurs, two patellas, um, two fibulas, two tibulas. What is it called? Um,
Tarsals.
14
tarsals.
meta, 14 tarsals on both. 14 tarsals, 10 metatarsals, and 28 phalanges.
Amazing.
Um,
There's
Long bone,
Uh,
long,
Short,
short,
flat,
6.
flat,
pneumatic,
quite
sesamoid,
irregular.
pneumatic.
Lovely.
pneumatic,
Yes, good job. Oh my
equal.
god, good job, Naseba. So proud of you.
Thank you. Thank you. Thank you.
What is the definition of a long bone?
A long
Wider
bone
than the
is a
shaft.
bone that is, yeah, and it has two diaphyses and
No,
what
one
No, that
diaphysis,
one
one
diaphysis, two
diaphysis,
epiphyses, and one metaphysis, which is irrelevant apparently.
and then the epiphyseal plate.
no. There are two metaphyses because there are two epiphyses. There will be two metaphyses, I believe.
There's
Okay.
also two epiphyseal plates,
Yes.
right? Or is it just one? It's two, right?
No, there's one epiphyseal plate.
Really?
Oh,
Yeah,
actually,
No,
wait,
there's
no, there
two.
are.
There's
No,
two.
there's two. There's two.
This. Okay, yeah, there's
there
two.
is
You're
2.
asking the bad. I'm sorry, that was misinformation. But yeah, there are two.
So the part where it gets ossified, I think that's called endochondral ossification,
That's for
where it doesn't
the.
grow anymore, right?
I cannot answer that question.
Out of our
So only the
expertise.
I
long bones would go through endochondral. So again, later on,
Yeah, so this is
inshallah,
a long
soon.
bone. So
Okay.
Yeah.
Okay.
this is a long
So
bone.
Miss Khatija is
So
correct.
yes, she's correct. Also, cancellous is another name for spongy.
Okay.
Cancellous is
Okay.
another space. Okay. Um, what else? What are examples of? What are the two subdivisions of a long bone?
Tubular and
Mm,
what was the other?
long
Long
tubular and short
tubular
tubular,
and
right?
short
Long tubular,
tubular.
short tubular.
Okay, and what are the examples of each? Name three examples of each.
अब ये नहीं पता.
Ah, you know the axial and appendicular skeleton already. Just associate them already. Just connect them. It's the same thing, just different names. Come on, just look at your hands and arms and limbs.
Is long tubular femur and humerus?
Yes.
Yeah, and tibia fibula, I guess, also counts, and
And then the
radius
short,
ulna.
Yes.
and the short tubules are your carpals.
No.
Yeah,
Carpals are short.
Okay.
or phalanges and metatarsals, metacarpals.
Yes. Yes.
Okay.
Those are short tubulars. Okay.
Yes.
Then we have a short bone. What is the definition of a short bone?
Cube shaped,
Cuboidal shaped.
and they have a
Cube shaped.
spongy interior, which is in the surrounding,
Yes.
and
No.
it is in the surrounding. It is surrounded by a compact layer, compact bone layer.
Yes. Yes. That is the proper wording.
Hmm.
Your intent was in the right spot. Uh, what
Yeah.
uh, what are examples of a short bone?
Like carpals
Mm-hmm.
And tarsals.
And
and tarsals.
yes.
Tarsal.
And yes. Okay. What are flat? Flat? Yeah. What are flat bones?
So they're thin and generally curved, and they're like a nugget of chocolate wafer. So there are two layers of compact bones, and they're sandwiching a layer of spongy bone,
Yes.
right?
And
Okay.
two parallel layers,
They usually
right?
surround some kind of body cavity.
Yes. And what are the examples?
Ribs and skull.
Uh,
Yes. And then we have, what do we have next?
sesamoid.
Irregular bones.
Oh,
Irregular,
irregular.
irregular. What are irregular bones?
Irregular bones for you.
Irregulars are the simplest.
Pelvic and
No, no, not
pelvic
examples.
and
What are?
capilla.
Define an
Oh, what
irregular bone.
are
How would you categorize them?
the
Yes.
ones
Cannot
that
be
How would you?
classified into
fill in
any
with the
specific
metaphors?
shape.
So they have thin layer,
No, no specific shape,
compact bone,
like Khadija said.
and they're
Yes.
surrounded by a spongy interior.
Uh, Ahmed, you keep saying they are surrounded by a spongy interior, but the thing is, the interior needs to in the compact bone is surrounding the is a spongy interior. It is compact bone that is surrounding it. The spongy is interior, right? So it can't be
Yeah.
surrounding spongy interior. Your phrasing is a bit off.
Oh, okay. So what would be a
How
like a better way to
so
explain it?
it's just that if you're mentioning if you're mentioning it properly, right? So uh, if you're going inside out, then it's a spongy interior surrounded by a compact bone, or a compact bone that is surrounding a spongy interior. But your phrasing gets
Compact
mixed up
bone
in between
surrounding.
those two. Okay. Um,
Oh,
what
right,
are the
right.
examples of a irregular bone?
Hip bone,
The
Pelvic.
hip bone.
and vertebrae.
And what are sesamoid bones?
They're embedded in
Oh shit!
between
I'm sorry.
tendons, or yeah, they're embedded in between tendons, and they don't have any periosteum, and nor are they ossified in children in babies.
In fetuses,
Fetuses.
so they
Yeah.
ossify after birth.
Okay. Okay, yeah, they ossify in afterbirth. Epic.
And they have
Yeah.
four functions.
What? Yes. What are the functions?
They resist pressure,
Mm.
um, reduce friction,
Yes.
um, I don't know. Oh, so
They alter the direction of the pull of the muscle,
right.
and they maintain local circulation.
Fair.
So these two are simple, very easy,
Hmm.
and these two are a bit more technical that will probably make more
Yeah.
sense of tomorrow.
Okay.
Ah, what
Sure
are
enough.
pneumatic bones? Inshallah. What are pneumatic bones?
They
Hmm.
have air spaces in
Bones
between
between
them. They're
Yeah.
connected to the nasal cavity.
Maxilla region, ethmoid, sphenoid, and what's the other one? Um, uh,
Sphenoid
Ethmoid.
yeah, ethmoid, sphenoid. What was the third one?
and sphenoid.
maxilla.
Maxilla. Okay, I already said sphenoid and ethmoid. So okay, I thought there was another one other
And
than
what is the function of having those air spaces in a pneumatic bone?
air conditioning
Active air chambers and
Air
have
conditioning.
resonance of voice,
and
and
voice.
Yes.
it
Yes.
makes the area lightweight.
Hmm.
Central air
Yes.
conditioning.
Central light. Central air conditioning. Yay, we're done. Good on us.
Alhamdulillah.
We're done with
Alhamdulillah, finally.
two subdivisions, alhamdulillah.
Alhamdulillah.
Inshallah, we'll finish this whole subtopic tomorrow.
So that wraps today's lesson up.